Wisconsin's Governor Walker has called for a special legislative session on what he calls welfare reform. I'm Bryn McBride of ABC for Health. The changes he's asking for are largely in the programs of FoodShare and Wisconsin Shares, but there's a little Medicaid mixed in there as well. Now, these aren't the traditional welfare programs that we're familiar with. They're more of the public benefits programs, and the programs like FoodShare are largely federally funded. The changes are coming asking for things that we've heard in the public assistance realm before from other Republican governors, things like increasing work requirements and photo IDs. Let's take a quick look at some of the bills that have been included in this call for a special legislative session, one that already kicked off on January 18th and should run for the next week or so. Some of the provisions include adding some asset restrictions in the FoodShare program, WisconsinWorks and Wisconsin Shares program, requiring parents of children in FoodShare to work. Now, Wisconsin did have a pilot program asking adults without dependent children in the home to meet a work requirement. We'll talk about the impact of that in just a second. This would expand that requirement to parents, those that have dependent children in the home. And it wouldn't just be a work requirement of 20 hours a week like we saw before. This would be for all folks required to work 30 hours a week to maintain your FoodShare benefits. Some of the other changes are requiring child support compliance in the medical assistance program. We need to see a little bit more about what that looks like when he says medical assistance program. There already is some requirement to cooperate with child support right now. Photo ID cards for FoodShare recipients, and this is couched with the excuse to crack down on fraud, asking anybody that receives FoodShare to have their picture on their FoodShare card. Now, as you can see, logistically, this might mean more people are kept from the program. Creating up to $20 million fund to pay private contractors doing welfare, corrections, and training work, and creating health savings accounts for Medicaid recipients. That's the one provision that impacts the Medicaid recipients the most out of this whole special legislative session package. Now, we did talk about work requirements before in FoodShare, but the special legislative session welfare reform package calls for work requirements to be added to the public housing programs, as well as drug testing for those public housing programs as well. The impact right away, proponents are speaking out quite vigorously, saying, first of all, you're adding nothing but hoops and hurdles into the path of people trying to access these programs, especially people trying to access food support. And they're most worried about those parents receiving their FoodShare benefits when they have children in the home. Working 30 hours a week is a pretty high hurdle, especially if you have parents that are also caretakers, especially if they're caretakers of small children and trying to make ends meet. The work requirement in FoodShare for childless adults, like we mentioned before, had quite an impact. It cost the state about $18 million to administer. About 24,000 adults without dependent children in the home did find work where they hadn't found it before. However, that was at the expense of 86,000 individuals being kicked off of their federal benefits. And now is a good time to remind us that FoodShare is a federal benefit. The money coming into the state comes from the feds to support the FoodShare program. So Wisconsin would be spending its own money to administer some of these work requirements and hoops and hurdles, while potentially losing federal money to actually pay the benefits to the consumers. Why are we doing this now? Opponents of this package is saying, well, we're looking for some easy legislative victories for the governor in an election year. So there appears to be a political motivation behind this welfare reform package. It's also on the heels of a national conversation about work requirements and Medicaid. We have a separate video on that to keep you posted on how that is rolling out. You can read this executive order in the package yourself with a little bit more detail, and it comes right from Governor Walker's press release, right on the governor's homepage, right in the state of Wisconsin. Keep your finger on the pulse and keep watching these videos, and we'll keep you up to date as we learn more about this and other healthcare coverage programs. You can send us your story, an email, or ask a question, and you can do all of it at healthwatchwisconsin.org. Thanks for joining us.